Welcome to another video from My Hematology where we make hematology simple. Today we will be exploring the topic of folate deficiency. Before we dive into folate deficiency is classified as a nutritional anemia under the banner of megaloblastic anemia. So what is megaloblastic anemia? Megaloblastic anemia is defined as a type of anemia caused by defective DNA synthesis due to vitamin B12 or folate deficiency. This causes delayed red cell maturation or ineffective erythropoiesis in the bone marrow, leading to macrocytic red cells and others. Hematopoiesis, or the production of blood cells, depends on orderly cell division and differentiation for expansion and maturation of progenitor cells into members of circulating blood cells. For this to happen, vitamin B12 and folate is needed for nucleic acid or DNA formation. Insufficient vitamin B12 or folate in the body will lead to megaloblastic anemia, in which DNA synthesis is impaired, resulting in slowing or arrest of cellular division during DNA synthesis phase of the cell cycle, which is the S phase. A high percentage of defective cells undergo apoptosis, leading to ineffective erythropoiesis. However, RNA synthesis and cytoplasmic differentiation are relatively unaffected. Thus, surviving progenitor and progeny are enlarged or have the appearance of macrocytic cells, which results in macrocytic or large red blood cells, hypersegmented neutrophils, and thrombocytopenia. As this is a nutritional disorder, folate is found primarily in fruits, vegetables, liver, and certain meat products and can be inactivated by prolonged cooking. Following ingestion, dietary folates are converted to methyl tetrahydrofolate during absorption through the small upper intestines. Once inside the cell, they are converted to folate polyglutamates. Folate binding proteins are present on cell surfaces, including the antherocyte, and facilitate entry of reduced folates into the cells. All body cells, including those of the bone marrow, receive folate from plasma as methyl tetrahydrofolate. Vitamin B12 is needed in the conversion of methyl THF to THF, a reaction in which homocysteine is methylated to methionine. During another reaction involving the conversion of the amino acid serine to glycine, a methyl group is transferred to THF to form N510 methylene THF, which is required for both de novo purine biosynthesis and for the conversion of deoxyuridylate to deoxythymidylate. Thus, cobalamin and folate both play critical roles in the production of the building blocks of DNA. Folate deficiency most often results from a poor dietary intake of folate alone, like veganism, or in combination with a condition of increased folate utilization or malabsorption, like celiac disease. Excess cell turnover, like in pregnancy, is the main cause of an increased need for folate, as the folate molecule degrades when DNA synthesis is increased. Other less common causes include certain drugs and renal loss through dialysis. Signs and symptoms of folate deficiency include general features of anemia, which can be presented initially like lethargy and mild jaundice or shortness of breath. In more severe cases, some patients develop angular stomatitis, a sore, beefy red, smooth tongue due to atrophy of the papillae, sterility, or fetal neural tube defects. in laboratory investigations. There will be a general reduction in all blood cells production, and the red blood cells are macrocytic. The peripheral blood smear reveals anisocytosis and macroovulocytes with hypersegmented neutrophil, which is an important indicator of megaloblastic anemia. Specific folate deficiency tests include serum and red cell folate, which should be reduced. For treatment purposes, patients with folate deficiency are given oral folic acid. Most cases only need therapy with the appropriate vitamin. Before we wrap up, let's go over the key points of folate deficiency again. Signs and symptoms of folate deficiency include features of anemia like shortness of breath and lethargy, specific signs like glossitis, angular stomatitis, and neural tube defects. Causes of folate deficiency could include increase in requirement of folate, malabsorption, veganism, certain drugs, or dialysis. Laboratory investigations of folate deficiency will show a decrease in hemoglobin level, an increase in mean cell volume indicating macrocytosis, and generally pancytopenia. The peripheral blood film will also show ovulomacrocytes, anisopoikilocytosis, and presence of hypersegmented neutrophils. Specific tests of folate deficiency include a decrease in serum and red cell folate levels. And treatment and management of folate deficiency is very simple with the giving of oral folic acid. If you like this video, click like and subscribe for more videos, and thanks for watching.